So in the last classes, we have already dealt regarding congestive cardiac failure, that is CCF or CHF, and we have seen the definition, the etiology, pathophysiology, clinical manifestations. Now moving on to the diagnostic evaluation. How are we going to diagnose heart failure? Now probably first we will have to ask regarding the history, like regarding the risk factors, what is the age of the patient, whether there is a family history, and what type of a diet the patient is taking, or whether the person is what type of occupation he is engaged in. All this can be collected from the patient party. Then a thorough physical examination also can be performed. So in the physical examination, as we have discussed, we can listen to the abnormal heart sounds also. Then blood investigations can be performed. Like there are so many blood investigations like cardiac enzymes, which are the cardiac markers like your troponin, myoglobin, creatinine kinase. Liver function test can be performed, or renal function test can be done. Okay, you can also assess the patient's cholesterol levels in the blood. Okay, all this can be done in order to find out what is the reason for heart failure. And most of the time chest x-rays is also done. So in the chest x-ray, what you can see is you can detect or find out enlarged heart. Okay, so enlarged heart will show that there is more amount of workload on the heart. So because of that, the ventricle enlargement or hypertrophy can be detected. Along with that, hemodynamic monitoring is a must. Now hemodynamic monitoring is nothing but refers to the measurement of the pressure, flow, or even oxygenation of the blood in the cardiovascular system. And it sometimes uses some invasive technologies in order to monitor the cardiac functioning. For example, by use of the central venous catheter, or by use of a pulmonary artery catheter. Okay. Next is 12 lead ECG. Now, ECG will also help to detect if there is any abnormalities in the heart or arrhythmias. Okay. Then echocardiogram, that is a recording of mechanical activity of the heart, where you are performing the scanning of the heart. Pulse oximetry will help to detect the oxygen saturation in the patient. Okay. And cardiac catheterization or coronary angiogram, which is a very important procedure, and it will help to detect if there is any uh, blockage within the coronary arteries. Okay, because of atheroma or plaque deposition. Other than that, we can also go for a CT scan, that is computerized tomography, or even MRI. MRI that refers to magnetic resonance imaging. So next, moving on to the management, we'll move on to the general management or into the nursing management. So a person who is having heart failure will be given a complete bed rest, because when you are doing more and more activities, the workload on the heart will be more. Okay, and the heart will have to pump harder in order to provide with oxygenation. So most of the time, a complete bed rest is advised to the patient. Okay, and usually the position that we give is a high Fowler's position or a semi Fowler's position. Then other than that, vital signs have to be monitored, including the heart rate, the blood pressure, respiratory rate, intake output, or the urine output has to be monitored. So every hourly, usually they will be monitoring the vital signs of the patient. Continuous monitoring of ECG, pulse oximetry by means of a cardiac monitor is very, very essential. Then hemodynamic monitoring, as I have already discussed. Then possible cardioversion. If at all the person is having lethal arrhythmias, in that case, you can go for a cardioversion. We have already discussed regarding cardioversion in detail. And sometimes, if the person is having severe bronchospasm, where oxygenation is not possible, in that case, we will have to intubate the patient, and we'll have to put the person on a mechanical ventilator. And most of the patients with the heart failure, they may require continuous oxygen. Okay, we know there are different methods of oxygen administration, like we can go for a mask. Okay, we have got venturi mask, nasal cannula, nasal catheter, Okay, nasal prongs is available. Other than that, partial rebreather mask. There are different methods where you can provide oxygen to the patient. So based on the condition of the patient, you can provide 2 to 3 liters or even up till 6 liters of oxygen to the patient, and it will help to relieve the hypoxia. Other than that, a person with a heart failure will not be able to uh, perform their activities of daily living. Okay, self-care activities will not be possible because they will be having lot of fatigue or weakness. So providing adequate periods of rest is very essential in between the activity period. Monitoring of weight is very essential in heart failure patient. Now, particularly, we have studied that in case of right-sided heart failure, the patient is having generalized edema, anasarca, peripheral edema is present, isn't it? So, to detect that, what we have to do is monitoring of the weight. Okay, so when you're monitoring the weight, see that you're monitoring the weight of the patient at the same time, and they are wearing the same type of clothes. Okay, and other than that, because of this edema or water retention, usually there will be fluid restriction for the patient. Always remember, especially for a heart failure patient. Okay, so fluid restriction is very adequate, and along with that, intake output chart will be maintained very strictly. Okay, and ask the patient to avoid taking sodium in the diet, because taking more and more sodium in the diet may result again in water retention. Okay, then few other surgical management is there that I will discuss in the coming slides, like your ventricular assist device or CRT, that is cardiac resynchronization therapy, and cardiac transplant. Okay, along with that, certain other risk factors have to be avoided, like ask the patient to stop smoking completely, because that is a major factor for heart failure. Other than that, restricting alcohol in the diet or reducing or avoiding salt in the diet. Okay, maintaining or performing some passive exercises or range of motion exercises is very essential. A good nutrition is very necessary for a person with the heart failure. Okay, because a person may be emaciated and will usually have an imbalanced dietary pattern. And if the person is having again dyspnea and all, we can slightly raise the head end of the patient and provide a semi-phallus position. Okay, reducing stress is again essential, because that also can trigger the heart failure. So ask a person to perform yoga, deep breathing exercises, and even lifestyle modification is essential, like taking less amount of fat rich diet or cholesterol rich food, and along with that, regular exercises, monitoring the blood sugars, monitoring the BP of the patient, cholesterol of the patient. Okay, and also avoiding high intake of tea and coffee. Okay, so this is one small mnemonics that you can use. UNLOADFAST, unload fast. Okay, it is just a mnemonics for you to remember. Okay, so next, now moving on to the medical management. Now the pharmacological drugs that is given to treat heart failure, it is very important. The first major drug that you should remember when I tell heart failure is digitalis or digoxin, which is actually a cardiac glycoside. Okay, and you should also remember first drug is diuretics. Okay, now we will discuss regarding each one of these drugs in detail. Diuretics, morphine sulfate, AC inhibitors, vasodilators, beta adrenergic blockers, positive inotrophs, angiotensin 2 receptor blockers, and antiarrhythmic drugs. We are already knowing about all these examples and all. We'll just see about it. Now, why we are giving diuretics for a person with heart failure? Because already here the patient is having edema, water retention, so we have to reduce the water retention in the patient. Okay, so in order to promote this excretion of water and sodium, we will have to provide diuretics. We have got a wide range of classification of diuretics, like loop diuretic, thiazide diuretic, potassium sparing diuretics. So these commonly drugs are given to treat heart failure. The most common drug that we give is Lasix, okay, that is furosemide, and even spironolactone. Now, vasodilators, we know vasodilators are responsible for relaxing the smooth muscles. The most common vasodilator that we use is nitroglycerin or sodium nitroprusside. Next one is ACE inhibitors, angiotensin converting enzyme inhibitors. Now, particularly if at all hypertension is the main cause for hypertension, main cause for heart failure, in that case we will have to give any antihypertensive, particularly like ACE inhibitors, okay, like captopril, enalapril, benzapril. Next one is beta adrenergic blockers. Now, beta blockers are those drugs again which are one of the type of antihypertensives, and examples are atenolol, propranolol, metoprolol, okay, carvedilol. Now, what happens is this most of these antihypertensives tend to have certain side effects or adverse effects. Like they will lower the blood pressure in the patient. Okay, they can cause hypotension or they can cause excessive fatigue and bradycardia. So always use this antihypertensives with caution. Okay, when you're using these drugs, you will have to monitor the heart rate and the BP of the patient. The next one is positive inotrophs. Now, certain times what happens is the heart's workload will go on increasing, and that will for certain period of time there will be increase in cardiac output, okay, but finally because of more and more workload the cardiac output will be reducing, okay. So in that case we use the most common drug, that is digitalis, okay, or digoxin. And there is one more positive inotrope that we use is dopamine and dobutamine. Commonly, dopamine and dobutamine is used when the blood pressure is low or when there is cardiogenic shock. But this digitalis particularly we use in order to improve the cardiac output or to improve the cardiac contractility. Now, digitalis is a very important drug. When we are usually giving the drug, we have to monitor the heart rate or pulse rate for 1 complete minute. Okay. If at all the person's heart rate is less than 60 beats per minute, we will have to withhold digitalis, because the main adverse effect of digitalis is it will cause bradycardia. Next one is angiotensin 2 receptor blockers like losartan can be given to the patient. Now commonly losartan is a drug that is contraindicated if you have got bronchospasm. Dietary management of a patient with heart failure. As we have already discussed, a patient with heart failure will have to reduce the salt in the diet. Okay, salt in the diet has to be avoided. So obviously they can substitute the salt with the use of lemon juice and all, because we know that a saltless diet cannot be consumed by the patient. Along with that, tell the patient not to take processed food or junk food and all, because a lot of the processed food will be having high content of sodium in it. Okay, so they have to completely avoid the salt in the diet. Particularly if there is a mild heart failure, they can restrict the salt or sodium to less than 2.5 grams. But if there is severe heart failure, in that case the sodium has to be restricted to less than 1 gram, okay, that is 1000 mg, it has to be less than that much. Then if a person is having hypertension, we already know we recommend a dash diet, that is dietary approaches to stop hypertension. And tell the patient not to add salt or not to take pickled food and all, because it has a lot of salt in the diet. Then high sodium is usually available in, as I told, the canned food, processed food, cheese, frozen meals, so completely avoid it. They can also limit water and even limit milk products, okay. And tell the patient to always read the labels before they are buying the food items, okay. And we already know why fluid restriction is essential, because already the patient may be having a renal insufficiency, okay. Then tell the patient to monitor their weight regularly, okay. And also tell them to monitor the weight at the same time and with the same type of a cloth. Okay, so this we have already discussed. Tell the patient to take more of green leafy vegetables or even fruits in the diet. Okay, and they have to maintain a healthy body weight. Next is moving on to the surgical management. Now, actually, surgical management is only done depending on the condition. All the patients with heart failure will not be receiving a surgery. Okay, now the surgical management also depends on the cause. Okay, so depending on the cause for that particular surgical management, we can go. For example, if the cause of heart failure is um, coronary artery disease, in that case, what we do, we can go for a CABG surgery, isn't it? Or we can go for PTCA, that is percutaneous transluminal coronary angioplasty. Okay, so depending on the cause, we have to do the treatment. So next one is ventricular assist device. Now this device is new for you people. Okay. Now ventricular assist device is actually an implantable mechanical pump-like device. And why this ventricular assist device is used? As the name suggests, it is used to pump the blood, especially when the ventricles are not able to pump the blood. We are using this device. Okay. So it is called as a ventricular assist device and helps to pump the blood from the ventricle, and it is implanted in the chest or in the abdomen like that of a pacemaker. So what is the purpose of this ventricular assist device? It will help to improve the circulation. It will support the pumping of the heart, especially when there is a left ventricular failure. Okay. So particularly when we are using it in the left ventricle, if we use a ventricular assist device in the left ventricle, then we call it as left ventricular assist device. Suppose this VAD, that is ventricular assist device, is used in both the ventricles, that is it is used in left and right ventricle. We call it as biventricular assist device. Okay, so remember, ventricular assist device means it is helping to pump the blood in the ventricles, and especially when there is heart failure, it will be necessary. So as you can see here in the picture, it is having a battery. Okay, and you can see the picture clearly here with the VAD, ventricular assist device. So the next device is CRT, cardiac resynchronization therapy. Okay, so now this cardiac resynchronization therapy, it is nothing but insertion of electrodes into the right ventricle or the left ventricle of the heart. Okay, so CRT means insertion of electrodes into the left or the right ventricle of the heart. Now we can have two types of CRT devices. One is CRT-P and one is CRT-D. CRT-P means it is a cardiac resynchronization therapy by using pacemaker, and CRT-D means using a defibrillator, that is implantable cardioverter defibrillator. We have already studied regarding it, isn't it? Okay, so this CRT uses a device that is like a biventricular pacemaker itself, and it will send the electrical impulses sometimes. Okay, that is for CRTP. It will pace the heart. And CRTD means whenever there is an abnormal arrhythmias, it will send the electric shock to the patient. That is CRTD. Okay. Next is valve replacement surgery. Now, valve replacement surgery is only done if there is abnormal valves of the heart, like completely if there is damage of this valves, aortic valve or pulmonic valves and all. In that case, we will be using the valve replacement surgeries. Okay. Next one is implantable cardioverter defibrillator that we have already discussed. So if there is problem with the arrhythmias, lethal arrhythmias, then we can use this ICD. Then, if there is problem with the pacing of the heart, problem in the SA node or AV node, we can use the pacemaker, which we have already discussed in detail. The last option that we can go is for a cardiac transplant. Now, don't think that immediately if a person is having heart failure or anything, you will go for a heart transplant, because getting a donor heart is very, very difficult. Okay. So heart transplant is only done it is only indicated when there is a severe when there is severe cardiomyopathy or severe heart failure, where the person is not able to perform their activities of daily living at all, or if they have got a coronary heart disease or cardiogenic shock, which is very, very severe. Okay. Now, what is a heart transplant? Heart transplant is a surgical procedure where you are removing the damaged or the diseased heart and replacing it with a donor heart. Okay, that is called as a heart transplant or a cardiac transplant. Now, what is the criteria for the donor? Who can be a donor? Now, living man cannot be a donor, isn't it? You can just tell that you can donate the heart. Usually, a brain dead individual will be the donor for the heart transplant, and usually the age should be less than 55 years. Okay, and the person should be free from infectious diseases like hepatitis B or hepatitis C and HIV. Along with that, the person should not have severe hypertension, substance abuse like alcohol abuse and all, and they should not have a severe history of hepatic kidney conditions. Okay, and they should not have active uncontrolled infections or very active malignancy should not be there. And particularly before you are donate taking the heart of the person and you are doing a cardiac transplant, they will also see for the donor and recipient matching. Okay, blood type, body size, everything will be completely done. Okay, and most of these blood investigations or diagnostic procedures will be carried out before heart transplant. Okay, like ECG, echocardiogram, all the major blood investigations and diagnostic procedures will be done. Okay, then other than that, this is just an image of OT where they are performing the cardiac transplant. So next I will just tell you what is the contraindications for a heart transplant when you cannot take the heart from the donor. Suppose the donor is having malignancy, severe malignancy is there, or active infection is there. Okay, or if the person is very old, more than 60, 70 years, you will not take the heart from such individuals. Okay, and if they have got any severe kidney dysfunction, severe pulmonary artery pressure elevation is there, that is pulmonary hypertension is there, or if they are severely obese or malnutrition is there, or they are having any substance abuse, psychological problems, in that case usually we will avoid taking such persons donor heart. Okay, and next is the person should not have any infections conditions like hepatitis and HIV. Now, in heart transplant, we have actually got two types of heart transplant. One is called as orthotropic heart transplant and one more is heterotrophic heart transplant. Now, orthotropic heart transplant means you are removing the damaged heart and you are placing the donor heart, which is healthy heart. Okay, that is called as orthotropic heart transplant, where you will be removing the damaged deceased heart and you will be keeping the donor heart, which is a new one. Okay, then next type is heterotrophic heart transplant. Now heterotrophic heart transplant is actually meaning where you will be keeping the damaged heart parallel to that of the donor heart. Okay, where there are certain conditions where you need not remove the heart, they will keep the damaged heart also and they will keep the donor heart also. Okay, parallel to each other, that is called as a heterotrophic heart transplant. Okay, next is moving on to post-operative complications of heart transplant. Now particularly the main complications of heart transplant is infection, bleeding, then heart attack. Patient can have heart attack or they can develop with the pulmonary embolism. Okay, and right ventricular failure or respiratory failure. And one major type of complication is rejection. Okay, once you have received the donor heart, chances of rejection are very common. It can be hyperacute rejection, acute rejection, or chronic rejection. Okay, rejection can happen anytime, suddenly also, or after a year, or after 2 years, or after many years also. Okay, so for the rejection, to avoid the rejection, the person will have to take lifelong steroids or immunosuppressants. Okay, and they will have to avoid um, going to overcrowded places or avoiding contact with infectious people, then practicing strict hand washing, avoiding the visitors. That is very essential. And they will also have to perform endomyocardial biopsy. Now, endomyocardial biopsy means they will take a small tissue from the myocardium in order to detect for the rejection. Okay. Next is artificial heart. We know what is an artificial heart, isn't it? Now, artificial heart could be a silicon heart with the batteries and all. So, this is one 25 years old man who is survived till now with the use of an artificial heart. Next is what are the complications of heart failure. Now complications of heart failure, particularly it can be emboli. Okay, person can develop cardiogenic shock. They can also have pericardial effusion, cardiac tamponade. Okay, we have already discussed regarding these conditions where there is excess fluid accumulation in the pericardial sac. Then pulmonary edema, where there can be excess fluid accumulation in the lungs. Okay, infection can develop. There can be chances of MI. There can be chances of stroke, cardiac arrest, renal failure, respiratory failure. Okay, then arrhythmias can develop. Lethal arrhythmias can be there. Then in this clinical manifestations of heart failure, we discussed regarding right heart failure, left heart failure, In that we saw hepatomegaly, splenomegaly, anasarca. Okay, all that can be written as a complication of heart failure. Next is moving on to the nursing diagnosis. Because patient is having edema, we can write excess fluid volume related to cardiac failure. Patient is having dyspnea, and problem can be there also like a cough, okay, and blood tinged sputum. So we can write impaired gas exchange related to maybe immobility or increased preload. Since patient is having fatigue, you can write activity intolerance related to decreased cardiac output. Then already the person's workload on the heart is increased, and because of that there is low cardiac output. So one more nursing diagnosis you can frame is decreased cardiac output related to imbalance in oxygen supply and demand. So nursing interventions already I have discussed one by one. Assess the condition of the patient, assess the weight of the patient, monitor the renal function test, liver function test, intake output, administer oxygen, provide bed rest for the patient, provide all the medications, okay, reduce salt intake in the diet, you can provide potassium supplement to the patient, monitor for dyspnea, provide semifolius position, auscultate for breath sounds or abnormal heart sounds, then examine the skin turgor of the patient to check for any dehydration, and check the edema of the patient. Okay, so this is particularly regarding heart failure and the nursing interventions.